Here in Erie County, we learned that a good amount of those deaths were people who were nursing home residents. 2 on your side, Steve Brown's been looking into this, and he has the latest numbers.
Let's start our look at nursing homes with a look at some numbers. According to the New York State Health Department, as of Tuesday, 104 Erie County residents who had tested positive for COVID-19 had died. Of that number, 42 were nursing home residents. That's 2 out of every 5 coronavirus deaths that are people living in nursing facilities. And yesterday we reported that nursing homes cannot refuse any COVID patient who's been released from a hospital. Now, this was something that Erie County Executive Mark Polenkars talked about yesterday.
Nursing homes are required under New York State law to take in patients who may be positive for COVID-19. And of course, nursing homes are often taking the most frail in our society.
But why would the state health department require nursing homes to take in COVID patients from hospitals who may be recovering, who also may have the virus, introducing them to a population which is most susceptible to the virus? We asked the state health department that yesterday, and they did get back with us. In a statement, the health department repeated their directive from March 25th. No resident shall be denied admission or readmission based on a confirmed or suspected case of COVID-19. Now, does the health department directly assist nursing homes taking in these COVID patients from hospitals? The answer is no. The state health department statement says nursing homes should communicate personal protective gear needs to their local Office of Emergency Management instead. Here, that would be the Erie County Emergency Management Office. The only wiggle room in this directive is if a nursing home is not medically prepared to meet a patient's needs, they should not take that patient. But again, nursing homes cannot deny admission to anyone who is COVID positive. The policy has a purpose, and that is to free up hospital beds. The idea is if a COVID patient who's recovering no longer needs acute care, then they need to be moved from a hospital to somewhere. That somewhere, according to the state health department, is nursing homes. But the question still remains, why would the state health department move these people who may still have the virus into a population of people most susceptible to the virus? We're still waiting for an answer on that question. In Williamsville, Steve Brown, Channel 2 News.